So hi friends, I must say that I'm not just glad, I'm honored, and I'm very much happy to introduce you Dr. Lokesh Agarwal, Rank 1, AIIMS, November 2015. Congratulations, Dr. Lokesh, first of all, on your grand success. I must say that DBMCI family is honored to be associated with you in this manner. He joined us our regular course, then afterwards continued in different manners. But right now, just to start with, what exactly is going through your mind? What exactly you're feeling right now that being rank 1, November 2015 AIIMS, what exactly is going through your mind right now?
I wish this is not a dream.
Okay.
And it feels good
Mm-hmm.
when you work for something and you get it feels good and it motivates you that okay, work pays off.
Right.
So definitely work pays off.
That's pretty great. Just to start with, because you are associated with us
Yes.
so long, how was your experiences with DBMCI family?
It was a wonderful experience and a wonderful journey as well.
Mm-hmm.
Specifically speaking, for the
Mhm.
test and discussion course,
Mm-hmm.
the time that I have spent,
Mm-hmm.
those 1 day of test and discussion
Mm-hmm.
was equivalent to one subject.
Okay.
So it was really helpful.
Mm-hmm.
I could grasp what's needed in the subject
Mhm.
and what should be avoided, like
Mm-hmm.
just a passing look through.
Right.
So it really helped me.
Okay. That's pretty great. Very nice. I have heard that lots of questions came from the medicine side.
True.
Or connected to the medicine subject. How did that particular thing helped you in cracking this exam and being on here right now, rank 1? How did that help you?
Personally, what I feel, sir,
Hmm.
that nowadays questions are more conceptual
Hmm.
rather than factual.
Hmm.
So if you know the basic concepts and if you
Mhm.
apply them well,
Hmm.
you are most likely going to mark the right option.
Hmm.
So one good feature that I found in the test and discussion was
Mhm.
they were conceptual.
Hmm.
Every question was indicating a particular concept.
Hmm.
So that way it helped me.
Okay. Can you just come out with some point? The thing, if I must say that, I'm talking with a topper, and I want to know the mindset of a topper. Can you come out with a question or a point that at that time, at that particular time, with that particular question, what was exactly going through your mind, or what was exactly going through your mind while giving the whole exam? What is the mindset of a topper? What should be the mindset of the topper?
What I have learned from my teachers
Hmm.
is choosing the right answer
Hmm.
is important,
Hmm.
but that is not the end of the game.
Exactly.
One more important thing is ruling out the other 3 options.
Hmm.
So you can get the right answer in 2 ways.
Hmm.
Either knowing the right answer
Hmm.
or knowing that the other 3 are not right.
Okay. Right.
So for example,
Hmm.
in this year named November PG,
Hmm.
I got a question, a patient of MI 24 hours of chest pain and diaphoresis,
Hmm.
which of these should not be given?
Hmm.
So the question is asking you a particular concept, and this question has been repeated many times, but in an
Mhm.
indirect way.
Hmm.
The previous question was, when can thrombolysis be done?
Hmm.
When should it be done? And
Mhm.
till when can it be done?
Okay.
So answer to that was 12 hours and 24 hours.
Hmm.
This everyone knew
Hmm.
because it's given in all the guidebooks.
Hmm.
But this was application of that previous question.
Yes.
Because it had given previous 1 day he was having that chest pain and diaphoresis.
Yes.
So answer would be we won't do thrombolysis in this patient.
Hmm.
So it's just application of a previous knowledge in this question.
Right.
So
Right.
what
So
I feel.
that easily explains everything. How he became the rank 1 November 2015 AIIMS. Thoroughly impressed. to continue this, this proud moment and discussion with you. What did you think about the books and notes provided by DBMCI?
Regarding notes, one particular set of books that I was particularly impressed with was the DBMI Harrison series.
Okay.
It contains questions that are lines of Harrison.
Right.
So it motivates a person to read Harrison. For example, you read a chapter, you do questions, then you understand I've missed this point. And why did I miss this point? Is it in between the lines?
Right.
Or is it written beneath the figure?
Yes.
So it motivates you to read again. And then you come back to questions and again you miss a question. Then it motivates you that you're not reading well. You're missing on points. So this is a cycle, to and fro cycle. So it helps. It helps a lot.
That's pretty great. Some specific subjects you have attended here, which you like the most, or some points you want to share with us that these are the subjects I like the most, or something, some faculties you like the most.
All teachers were equally good.
Thank you.
Anesthesia.
I'll take this as a compliment. Thank you.
Definitely,
Thanks a lot.
Definitely. Anesthesia, radiology, radiodiagnosis. But I'll be doing injustice if I'm saying just two names.
Right.
Because I don't remember other. But all were equally good. And they were particularly helpful in solving controversial questions. Because what most of the people are going to mark is what the coaching institute says. So rather than wasting my precious time in finding out answers to controversial questions, it provided me the answer.
Right.
So that time was saved.
Yes.
So it really helps.
Exactly. Any specific compliments about our test series?
Test series. I used to give online tests. I never gave an offline test.
Okay.
In online tests, the questions were medicine questions, particularly were directly from Harrison. So again, it motivates you.
Yes, exactly.
To read Harrison.
Yes.
So I feel, and in current scenario, online tests are particularly helpful because they simulate the exact pattern of the exam, and you must know that review the question or leave the question or mark and pass. So that way it's really helpful. Time management.
That's pretty nice. I'll sum it up very quick. But before that, these particular times from past 2 or 3 attempts, the visual basic questions are getting into it a lot. So any any suggestions you want to share with the people seeing us through YouTube or Facebook or whatsoever social media they'll be seeing us, anything you want to share with them?
Please don't waste your time in visual questions, because 50% of the visual questions, if you don't see the visual, even then you can mark the answer, because the case histories are given. So it's just you are getting an additional help from the examiner. Earlier case histories were given, no visual, same answers. Nowadays just an added visual, same case history, same answer. So that's an additional help from the examiner.
Right.
In the remaining 50% of the questions, the visuals are from standard textbooks.
Right.
Standard textbooks, everyone knows the definition. Robbins, Harrison, microbiology, all the standard textbooks. So those visuals are from standard textbooks. And even those visuals contain a concept. For example, if this time photo of Brugia malai, microbiology parasite, was shown, and it specifically marked like 2 tail nuclei, cephalic space. Had that visual not had been there and only those questions, everyone would have marked the right answer. But some were afraid, "Arey, what is this parasite? What is this parasite?"
Thoda confusing ho jata hai us time. Right.
So believe in yourself and don't be afraid of visuals. They are actually to help you and not to make the question difficult.
Chaliye, before summing this up, guys, this is again Dr. Lokesh sitting right in front of us, and to sum this, I would say again a proud moment with us. Any suggestions? You are the rank 1. You'll be followed, and you'll be asked the questions and everything. any suggestions through DBMI platform, through Dr. Bhatia Medical Institute platform, you want to suggest to your juniors or upcoming who will be giving the exams in May and you know, things like that, any message for them?
One thing that I have learned in these 5 years of MBBS, and what I would just want to share, please believe in yourself. In this branch, there's lots of hustle bustle. There will be high, there will be low times, but believing in yourself is important. One failure doesn't matter, it makes you more strong. So challenge yourself, every day challenge yourself, and make it sure that you get defeated, because if you are not defeated, you won't grow. So please challenge yourself, believe in yourself. That is what is important.
Some final words for Dr. Bhatia Medical Institutes.
I would be just reiterating the facts.
Sure.
But what I have said in my previous discussion, they would have made my point very clear. Test and discussion, it really helps to focus. One subject, go to test and discussion, know what is important, read before test, read after test. That subject ends there.
Okay.
So in this way you can focus, you can this vast syllabus, you can just in 19 classes you can sum it up.
Okay,
So that way it helps.
So guys, again Dr. Lokesh right in front of us and giving us the precious time what we needed, and again it's a
Thank you so much.
heartiest congratulations from DBMCI family that you know, for your future, and may you will grow like a tree and give your shadow to so many people. Congratulations once again.
Thank you so
This
much.
was me, Sushant Grover, business head, DBMCI. Thank you.